Hi friends, welcome to the channel The Nurse. Here we are discussing about golden points you need to remember for all nursing exams. AIMS Mangalagiri, AIMS Bathinda, Niman's Nursing Officer exam, BHU Nursing Officer exam are coming. So prepare well, it will help you definitely. So we can start here. Before that, if you are not subscribed to our channel, please subscribe. So let's start. The nurse should moisten an eye patch when applying it on the unconscious patient. The nurse should moisten an eye patch when applying it on the unconscious patient to prevent corneal dryness and ulceration. Next one. Alcohol is a central nervous system depressant. Alcohol is a central nervous system depressant. Salicylates are the drug of choice for treating rheumatoid arthritis. Salicylates are the drug of choice for treating rheumatoid arthritis. Example of salicylate is aspirin. Next one. A low-fat diet is appropriate for the patient with cholecystitis. A low-fat diet is appropriate for the patient with cholecystitis. Viability refers to the ability of the fetus to live outside the womb. The term viability refers to the ability of a fetus to live outside the womb. A xenograft is a skin graft made outside from another species. A xenograft is a skin graft made of tissue from another species. A homograft means the skin graft made of tissue from same species. Homograft means same species. Xenograft means another species. Where autograft means the skin graft from same person. Autograft means skin graft from same person. Next one. Rubella is also known as German measles. Rubella is also known as German measles. Palm or pralidoxim is used in organophosphorus poisoning. Palm or pralidoxim is used in organophosphorus poisoning. Earlier, atropine is used for organophosphorus poisoning. Nowadays, pralidoxim is used for organophosphorus poisoning. Pterygium is connected to conjunctiva. Pterygium is connected to conjunctiva. It is a benign growth of a conjunctiva. Pterygium means a benign growth of a conjunctiva. Next one. JVP refers to jugular venous pressure. JVP refers jugular-venous pressure. The importance of JVP is it is elevated in right-sided heart failure or congestive heart failure. JVP is elevated in congestive heart failure or right-sided heart failure. Next one. Haemophilus ducreyi causes cankeroid. Haemophilus ducreyi causes cankeroid. Herpangina is caused by Coxsackie-A virus. Herpangina is caused by Coxsackie-A virus. Herpangina means a painful mouth blisters caused by virus, that is Coxsackie-A virus. A painful mouth ulcer is known as herpangina. Primary lung disease leading to right ventricular failure is cor pulmonale. Primary lung disease leading to right ventricular failure is cor pulmonale. Influenza virus is RNA virus. Next is influenza virus is RNA virus. Coxiella burnetii is associated with Q fever. Coxiella burnetii is associated with Q fever. Rickettsia rickettsica causes Rocky Mountain spotted fever. Rickettsia rickettsica causes Rocky Mountain spotted fever. Hypocalcemia in blood results in tetany. Hypocalcemia in blood results in tetany. Pinta A skin infection is caused by Treponema caratium. Pinda, a skin infection is caused by Treponema caratium. Rubella in the first trimester causes heart malformation in the fetus. Rubella in the first trimester of a mother causes heart malformation in fetus. Rhesus disease in newborn is caused by streptococci. Rhesus disease in newborn is caused by streptococci. Rhesus disease is also known as reactive arthritis. Rhesus disease is also known as reactive arthritis. It have a classical triad of conjunctivitis, urethritis, and arthritis. Rhesus disease has a classical triad of conjunctivitis, urethritis, and arthritis. Gumma is a lesion associated with syphilis. Gumma is a lesion associated with syphilis. Gumma is the soft non-cancerous growth resulting from tertiary stage of syphilis. Gumma is a soft non-cancerous growth resulting from tertiary stage of syphilis. Lymphangitis of dermis is called as erysipelas. Lymphangitis of dermis is called as erysipelas. Absence of speech is known as aphasia. Absence of speech is known as aphasia. FDE or fixed drug eruption are seen with the barbiturates. FDE or fixed drug eruption are seen with the barbiturates. FDE means an allergic reaction to a drug that characteristically recurs in the same site or sites each time a particular drug is taken. FDE or fixed drug eruption means an allergic reaction to a drug that characteristically recurs in the same site or sites each time a particular drug is taken. Burn patient needs high protein diet. Burns patient needs high protein diet for tissue repair. Next one, bromides induce acne. Bromides induce acne. Heberden's nodes are seen in osteoarthritis. Heberden's nodes are seen in osteoarthritis. Blue discoloration of periumbilical area due to hemoperitoneum is in acute pancreatitis is called Cullen sign. Blue discoloration of periumbilical area due to hemoperitoneum in acute pancreatitis is called Cullen sign. Anti-nuclear antibody or ANA is a cardinal feature of systematic lupus erythematosus diagnosis. ANA or anti-nuclear antibody is a cardinal feature of systematic lupus erythematosus diagnosis. The most important aspect of hand washing is friction. The most important aspect of hand washing is friction. Drugs used to decrease the gastric motility are anticholinergics. Drugs used to decrease the gastric motility are anticholinergics. These drugs are given before the anesthesia to prevent the gastric aspiration. Abnormal dilation of spermatic vein is known as varicocele. Abnormal dilation of spermatic vein is known as varicocele. The most important sign of tetanus is respiratory tract spasm. The most important sign of tetanus is respiratory tract spasm. That is the reason for death. The non-surgical treatment of strabismus is orthoptics. The non-surgical treatment of strabismus is orthoptics. So that is a muscle training, eye muscle training to increase the muscle strength, eye muscle strength. Leather-like thickening of outer skin layer is called lichenification. Leather-like thickening of outer skin layer is called lichenification. The part of ear which contains receptors of hearing is cochlea. The part of ear which contains receptors of hearing is cochlea. Astigmatism is a condition caused by irregular curvature of the lens. Astigmatism is a condition caused by irregular curvature of the lens. Cylindrical lens is used to correct astigmatism. Cylindrical lens is used to correct astigmatism. Scleroderma means hard skin. Scleroderma means hard skin. Nephrotosis is commonly called dropped kidney. Nephrotosis is commonly called dropped kidney. Absence of peristalsis in the esophagus is achalasia. Absence of peristalsis in the esophagus is called achalasia. Osteoporosis may be caused by prolonged immobility. Osteoporosis may be caused by prolonged immobility. So that is the complication of bedridden patient. The surgical procedure of otosterosis is known as stapedectomy. The surgical procedure for otosterosis is known as stapedectomy. Withdrawal symptom of alcohol is called delirium tremens. Withdrawal symptom of alcohol is called delirium tremens. Excess daytime sleep is seen in narcolepsy. Excessive daytime sleep is seen in narcolepsy. Still's disease is also known as atrophic arthritis. Still's disease is also known as atrophic arthritis. Still's disease is an acute inflammatory disease characterized by classic triad of high spiking fever, joint pain, and a distinctive salmon-colored bumpy rash. Still's disease is an acute inflammatory disease characterized by classical triad of high spiking fever, joint pain, and a distinctive salmon-colored bumpy rash. The temperature of water for tepid sponge is 80 degree Fahrenheit to 93 degree Fahrenheit. The temperature of water for tepid sponge is 80 degree Fahrenheit to 93 degree Fahrenheit. Retinopathy of prematurity is also known as retrolendal fibroplasia. Retinopathy of prematurity is also known as retrolendal fibroplasia. Hearing loss due to aging is known as presbycusis. Hearing loss due to aging is known as presbycusis. The drug which dilates the pupil is known as mydriatics. The drug which dilates the pupils is known as mydriatics. The serious side effects of gold salt is kidney damage. The serious side effects of gold salt is kidney damage. Gold salt is used for treatment of rheumatic arthritis. Gold salt is used for the treatment of rheumatic arthritis. The surgical removal of entire eye is called enucleation. The surgical removal of entire eye is called enucleation. Hematochezia is fresh blood in the stool. Hematochezia is fresh blood in the stool. Basic unit of all societies is family. Basic unit of all society is family. The ESI Act came in the year of 1975. The ESI Act came in the year of 1975. The official organ of TNAI is Nursing Journal of India. The official organ of Trained Nurses Association of India is Nursing Journal of India. The richest source of vitamin D is fish liver oil. The richest source of vitamin D is fish liver oil. The febrile seizures are examples of generalized tonic-clonic seizures. The febrile seizures are examples of generalized tonic-clonic seizures. Play during infancy is solitary play. Play during infancy is solitary play. Hypnosis is effective in phobia. Hypnosis is effective in phobia. Pain in the breast is termed as mastodynia. Pain in the breast is termed as mastodynia. An example of iron chelating agent is deferoxamine. An example of iron chelating agent is deferoxamine, that is used for iron overdose of iron. Pellagra is due to the deficiency of niacin. Pellagra is due to the deficiency of niacin. Neonate stomach capacity is 90 ml. Neonate stomach capacity is about 90 ml. Anti-sterility vitamin is vitamin E. Vitamin E is known as anti-sterility vitamin. Xenophobia is fear of strangers. Xenophobia is fear of strangers. Aseptic meningitis is caused by virus. Aseptic meningitis is caused by virus. All the meningitis that other than bacterial cause is known as aseptic meningitis, usually viral meningitis. So bacterial meningitis is known as septic meningitis. Viral meningitis is known as aseptic meningitis. The most important characteristics of toddler is temper tantrum. The most important characteristics of toddler is temper tantrum. Homosexuality in females is termed as lesbianism. Homosexuality in females is termed as lesbianism. Breast cancer is most likely to occur in the left breast. Breast cancer is most likely to occur in the left breast. The most common form of childhood cancer is leukemia. The most common form of childhood cancer is leukemia. The important diagnostic test in malaria is peripheral smear of blood. The important diagnostic test in malaria is peripheral smear of blood. The daily requirement of iodine is 0.2 milligram. The daily requirement of iodine is 0.2 milligram. Landau reflex appears at 6 to 8 months. Landau reflex appears at 6 to 8 months. Landau reflex means an infant when held horizontally in the air in prone position, the baby maintains a convex arc by elevating head and legs slightly flexed. Landau reflex means an infant when held horizontally in the air prone position, the baby maintains a convex arc by elevating head and legs slightly flexed. Aversion therapy is used for the treatment of alcoholism. Aversion therapy is used for the treatment of alcoholism. Hypovolemic phase of burns lasts for 48 to 72 hours. Hypovolemic phase of burns lasts for 48 to 72 hours. ICN adopted the Code of Ethics in 1973. International Council for Nurses adopted the Code of Ethics in 1973. Extreme form of habituation is known as addiction. Extreme form of habituation is known as addiction. Water content of urine is 96%. The approximate water content of urine is 96%. Deafness is seen with overdose of streptomycin. Deafness is seen with overdose of streptomycin. Pomeroy technique is used in tubectomy. Pomeroy technique is used in tubectomy. Increased intestinal absorption of iron leads to hemochromatosis. Increased intestinal absorption of iron leads to hemochromatosis. Chorea with altered behavior is seen in Huntington chorea. Chorea with altered behavior is seen in Huntington chorea. Tic douloureux is another name of trigeminal neuralgia. Tic douloureux is another name of trigeminal neuralgia. Cranial nerve of taste is ninth cranial nerve. Cranial nerve of taste is ninth cranial nerve. Inherited of acquired disturbance of heme metabolism leads to porphyria. Inherited of acquired disturbance of heme metabolism leads to porphyria. Inability to strengthen the shoulder indicates 11 nerve palsy. Inability to strengthen the shoulder indicates cranial nerve 11 nerve palsy. Urea breath test is for detect Helicobacter pylori infection. Urea breath test is for to detect Helicobacter pylori. Helicobacter pylori converts urea into ammonia and carbon dioxide. Helicobacter pylori converts urea into ammonia and carbon dioxide. It is a rapid diagnostic test for Helicobacter pylori infection. Urea breath test is rapid diagnostic test for Helicobacter pylori infection. Normal central venous pressure is 2 to 8 mm of Hg or 5 to 10 cm of water. So the video will end here. Thank you for watching this video and don't forget to subscribe our channel, The Nurse. Thank you.